Encephalitis lethargica is one of the greatest medical mysteries of the 20th century. Although cases do date back to the late 1500s, it was first identified by Dr. Constantine von Economo in 1916 while he was studying patients with unusual physical and neurological symptoms. In the coming years, the disease would sweep across the world, infecting about 1 million people, killing 1/3 of those, and leaving the survivors with a fate scarier than death, only for the epidemic to go away as quickly as it came. One of the biggest mysteries comes from how difficult the disease is to firmly identify. The symptoms begin with fever, chills, dizziness, or vomiting, but then quickly move on to include muscle spasms, oculogyrate crises, lethargy, weakness, or even psychosis, most commonly in children, which in severe cases led to self-mutilation. If the patient survived this, months or decades later, post-encephalitic Parkinsonism may set in, leading many to become practically immobile, completely conscious of the outside world, but with no motivation to do anything at all. With such a wide variety of symptoms, there is no definitive way to diagnose the disease, and suggestions of how to do so often contradict each other by requiring different symptoms to be present. There is also no known definitive cause. Viral infections, autoimmune disorders, and even the Spanish flu outbreak have all been theorized to be the culprit, but the results of these experiments are inconclusive at best and downright refuted at worst. Even the question of, is this disease contagious, is debated. Further experiments are going to be difficult as the quality of samples from the original epidemic is poor, and there's only a few cases worldwide each year. Because of this, treatments, likewise, are far and few between. One of the most promising and notable was L-Dopa, a drug primarily used to treat those with Parkinson's. When it was first used to treat those with post-encephalitic Parkinsonism, it worked wonders, and those patients who had been dead to the world for decades had awoken and acted normal. However, after a few weeks, patients began to develop a tolerance to the drug, and they slipped away. Sadly, no other breakthrough of equal success and significance has been discovered since L-Dopa, so for now, there is no cure.